Well, good afternoon. We appreciate everybody joining us for the third out of four sessions in our psychological first aid series. We know it's a long haul, but we hope you find it as valuable as we do and are enjoying the presentations. So wanted to start off today by introducing Joa, who will begin things. And so I'll hand off now to you, Joa Williams.
Hi, everyone, and welcome back. I'm glad to see everyone here again today. So thank you so much for joining us this week as we kind of start our third in four different training sessions that we're going to do for this ECHO with a particular focus on psychological first aid and thinking through some of the specifics of, sort of figuring out how this looks when you're implementing this particular model in your own communities when you do work with trauma-exposed youth and disaster-exposed youth and families. So again, we're glad to see everyone back. Thank you all for joining us and for being here today. And again, as always, I'll just say that we welcome your questions, your comments, your feedback as we go through today's ECHO. So please don't hesitate to jump in with any questions. And we will ask that you keep your microphone's muted for the time being, but if you have questions, I'm certainly open with folks just jumping in and asking if I don't otherwise see your question on chat, but we'll also try to keep an eye on chat and direct any questions there as well. And hopefully I'll ask my colleagues as well to sort of help keep an eye out for any questions that might come up. But again, just in mentioning my colleagues, I want to introduce the folks that are going to be here today working with me and sort of co-presenting with me. So if each of you, I'll ask that each of you would like to also introduce yourselves as well. I see that you're all on here. So Aaron, I wonder, Dr. Hamrick, I wonder if you could briefly just introduce yourself as well. And then maybe we can go down and then Melissa and Alice, I'll also ask you to briefly introduce yourselves.
Yeah, great idea, because we probably have some new folks. So I'm Erin Hambrick. I work at the University of Missouri, Kansas City, and focus on children who've been exposed to trauma, with disaster trauma being one of my areas of interest.
Thank you so much.
Hi, everybody. Good afternoon. My name is Melissa Maris. I am coming to you from Columbia, Missouri today. And I work with this project as a consultant. I work with a lot of particularly schools, but other youth serving agencies around trauma-informed care. So I'm excited to be back here with you all today.
Thank you.
Hi, everyone. My name is Alice Chun, and I work at the KU Medical Center. And my area of interest is working with children with disabilities, particularly autism. So it's great to see a lot of people keep coming back, especially many of you are probably on summer break. So welcome back.
Absolutely, and thank you all for introducing yourselves, and you'll hear more from them later on today as we talk about different core elements and components of psychological first aid. But I appreciate you all introducing yourselves, and I really want to echo what Alice said there as well. We're really glad to see some of the same folks back and to see some familiar names and faces, and I'm starting to recognize some folks' names and recognize some of you across just different echoes. So again, it's really exciting to see everyone back, and I feel like we're really sort of able to create a good climate here for this discussion and for this particular ECHO. So thank you so much. And again, I'm Dr. Joa Williams. As Robert introduced me a few moments ago, I work with Dr. Aaron Hambrick at the University of Missouri, Kansas City in the Department of Psychology, where I'm an assistant professor. And I'm also a practicing psychologist in the state of Missouri as well. So again, welcome, and we look forward to talking with you a little bit today. So if we can go to the next slide, a couple of housekeeping things that I'll just go ahead and get out of the way and knock out first. Just in terms of disclosures, you've all probably attended a lot of trainings, and usually we start with disclosures, and this will be brief because we don't have any disclosures. None of us have any financial disclosures to mention here. So we just like to make sure that we do mention that, no discussion of anything that we have any financial or commercial interest in. But if we go to the next slide, one thing that I will mention is that all of the things that we're going to talk about today, so psychological first aid, the core components that are embedded within that we're going to be focusing on today, are all things that are based on best practice recommendations to the best that we know of in the field and in sort of thinking about disaster and trauma response. And so we're going to be talking about things in clinical medicine that are based on evidence currently accepted within the profession. So these are all sort of best practice guidelines that, again, we hope we can talk about and discuss with everyone with a particular focus on how to take these guidelines and sort of make them your own, and make them relevant to the communities you're working with, and make them relevant to your own style for how you work with folks. And hopefully we'll be able to continue this good learning environment today and then next week for our final session. Which, speaking of next week, for our final session of the ECHO, I want to also just briefly remind folks here on the next slide to make sure that you take a look at the psychological first aid manual and take a look at core actions numbers 7 and 8 prior to the next training that we have next week. These are going to be the last two sort of elements that we'll talk about next week. And again, all the things that we've talked about in terms of the core components of psychological first aid up to this point, all the things we're going to talk about today and all the things we'll sort of wrap up with next week are all discussed in a lot more detail, along with some really great handouts and references in the psychological first aid manual. And the great thing about that is that it's free, it's publicly available online, both through the National Center for PTSD, as well as the National Child Traumatic Stress Network websites. So you can access all this stuff for free, and it's got some really, really good resources in there to just give you a little bit of a refresher on things we discuss, give you an overview of things that we will talk about, and there's some good stuff in there that you can also use in your communities when you're working with disaster and trauma affected youth and families. So be sure to take a look at that, really good stuff in there. Also, presentation materials, all the slides from today, link for everything, the chat log will be emailed to you following this session, so you'll have access to everything from today's training as well. So we'll make sure that we get that out to folks. And as always, please don't hesitate to follow up with us directly with any questions that you might have, and feel free to jump in with any questions you have during today's training. So with that, welcome back, everybody. So for today's agenda, we've got several things to go over. I think we've kind of got a full packed sort of agenda for the day. So hopefully you're in a good, comfortable place, right, where you've got the AC on, because boy, we've got a heat wave settling in over Kansas and Missouri. So let's just, hopefully everyone's comfortable and in a good, comfortable spot for the next couple of hours. But we're going to start off today by talking a bit about 3 different core actions that are sort of essential parts of psychological first aid. And I'll start off today by talking about core action number 4, which is information gathering. So with information gathering, thinking about how do we find out what needs are going to be most relevant for the survivors that we're working with? So if we're working with trauma-exposed victims, disaster survivors, what are their immediate needs? How can we frame this particular intervention and response to what's going to be most helpful for them, right? So that requires us to kind of be attentive to what kind of things are going to be most pressing for them in terms of their immediate needs and concerns. So we're going to talk about information gathering a bit. And I want to also just sort of mention that when we talk about information gathering, this is going to be a core component involved in psychological first aid. So some of the components that are in here, or the core actions that we'll talk about, are going to be optional. Not every survivor is going to need every single one of these different core actions, right? But the things that we've talked about up to this point, things like contact and engagement, safety and comfort, information gathering, these are all going to be sort of core things that we probably are going to do with almost anybody where we use this particular model or approach. So I think this will be an important core action for us to discuss before jumping down and talking about sort of other optional modules that you may find appropriate for some survivors and not so much for others, right? But are all still equally important in thinking about how we do psychological first aid. So we'll talk next about core action number 5, providing folks with practical assistance, and Dr. Hambrick's going to talk with us a bit about practical assistance and what that looks like. And then we'll talk about a very important component, core action number 6, connection with social supports. And Dr. Maris is going to talk a little bit about that with us. And again, I think that's a particularly important action because some of you might remember from our first ECHO session that really with early intervention, we want to mitigate risk factors for long-term problems or long-term kinds of issues that potentially could be offset with appropriate support early on. And lack of social support is a big risk factor for problems down the road for folks that experience trauma and disasters, right? So the connection with social supports is going to be particularly important. We'll take a break around 1:55 so everybody can sort of stand up, stretch, get some water, and kind of get ready for the second part of our time together today, where we'll do some breakout rooms, practice some of the things that we talk about. And then collectively as a group, we'll talk a bit about a scenario so we can think about how this, sort of looks when applied to real life situations, things that some of you have actually encountered and shared with us. So hopefully that'll sort of help give it a little bit of life and relevance, right, as we think about how this might look in some of the cases that we actually encounter just from day to day. So we've got a lot to cover today. But with that, I think we're probably at a place where we are ready to go ahead and move into our first core action. So is everyone ready? Let's go. All right, so we're going to start again by talking about the next core action in psychological first aid, information gathering. So I mentioned earlier that this is going to be a particularly important component in psychological first aid because this sort of sets the stage for everything else that's going to happen in the PFA encounter, right? So by the time you start to gather information, we assume that we've probably already made contact with the victim or the trauma exposed individual or family, and we've engaged folks. We've sort of introduced ourselves. We've told them who we are. We've tried to make sure that safety and comfort are immediately addressed, and so we've tried to set those conditions for folks. If stabilization is needed, we've provided that. And now our next real task is to find out how can I be most helpful, most useful for this person, this child, this family, this adult. What is it that they most need from me, and how can I be most useful for them at this particular moment as they're trying to sort of just feel their way through the disorientation and confusion that can sometimes come in the wake of trauma exposure, right? So what do they need and how can we be most useful for them? So that's where information gathering is going to come in and going to be particularly important and helpful. So if we go to the next slide, the goal of this one, again, as I kind of just mentioned, the goal of this module is really just to identify what are a person or a family's immediate needs and concerns. And once we kind of have that information, not only does that help us get to know the person or the family that we're working with, it also tells us something about how we can most effectively tailor the intervention in the next little while to come, right? So if we know we only have 45 minutes, 30 minutes, or even an hour if we're lucky with someone, this is going to tell us what we can do, what other modules are going to be most useful for them. So I think information gathering is a really essential piece. And we'll spend a little while talking about that, ways that you can gather information. What information do you really want to know, right? And what information is going to be key to know? And then sort of think through some questions and some things that you can sort of file away in your mind to help you gather some of this information. Okay. So if we go to the next slide, there's really two steps that I think are absolutely essential for information gathering, okay? So let's just start by talking about step one. What are the pieces involved in information gathering and what is it that we really want to do here? Well, in step one, we want to start by just identifying the survivor's current needs and concerns by asking a series of key questions. And you can take a look at the psychological first aid manual. There's some really nice handouts in there that sort of give an overview of the kinds of questions that you might want to ask. Also give you an overview of just the general information that you want to gather, right? But I think overall, we really just want to find out what are a person's immediate needs and concerns across several different domains that we'll talk about here in just a few minutes. But we want to do it in a conversational way. And the psychological first aid developers sort of recognize the importance of having these conversations in sort of a really, sort of conversational way that people feel comfortable talking to us about what their immediate needs are. So what are some of the questions we want to ask to sort of set the stage for gathering information about a person's immediate needs or concerns? Well, one of the first steps in that is going to be that we just might even ask, like, how are you doing right now? Right? So, we've introduced ourselves, they know who we are. We've sort of checked in about safety and comfort and made sure that people are in safe conditions where they feel like they have a quiet, private place to talk to us. But how are you doing right now, right? So I think just asking in an open-ended way, see what folks tell us, right? See what folks give us. That can be a really good way to start. But then we can start to get a little more specific. What are some of your immediate needs and concerns right now in this moment, right? And that's going to, again, just sort of help point us towards specific kind of things that we might want to start noticing and file away as we start thinking about different areas that we want to assess. So I think just starting the whole information gathering process in an open-ended conversational way really sets the stage for sort of making information gathering most effective and most patient-centered, right? And trauma-informed as well. But the second thing that I want to say—
I'm just going to jump in, Joa, and say it's not patient-centered, it's person-centered.
Person-centered, right? Person-centered. Thank you. Thank you.
And I don't say that to Joa and I know each other well, so I feel
Very
like
much.
I could do that to you. But it's such an important thing right here that those of us with mental health backgrounds and licenses really do differentiate this process, because it's not a mental health encounter. So anyway.
That's an excellent point. No, that's a really, really good point. And I'm glad you jumped in and sort of mentioned that. But Dr. Hambrick's right. I mean, we do want to create this, we want to focus on the person, right? And I think that is essential. And that's what we want to come across when we start to ask these questions, right? So let's think about, how do we focus on the individual and the person and their humanity at a time of real vulnerability, right? For what can be for folks a time of real vulnerability. And with that, to better understand what their immediate needs and concerns are, I think it's also helpful for us to ask, what happened to you? How did you experience the disaster or the trauma that just recently occurred, right? So what happened to you during the event, and how were you personally affected, okay? So why do folks think that that might be an important piece for us to ask about here? Because recall, we've said, I think across both of our last two trainings, that the goal of psychological first aid isn't necessarily to get a lot of detail about the trauma, right? And in fact, I'm going to talk about next why that's probably not necessarily a good idea for a contact like this. So why do we want to still ask people what happened to you and how were you affected? Any thoughts about that? Yeah, so the severity of those who were impacted, the essence of yeah, so it's essentially person-centered and trauma-sensitive to even, recognize and acknowledge the severity and impact of what a person has just gone through, and it shows that we're acknowledging that, right? So I appreciate that. Thanks for folks who sort of chimed in on chat there, and I think you're absolutely right about that. And so listening for strengths, yeah, so that we can sort of leverage moving forward in the moment, and it gives us a sense to sort of start listening for where the person is now, and are there strengths there, and what strengths there are we sort of seeing in the moment that we can draw on. So, and then to triage needs, someone else mentioned that there, and that's absolutely true. I think, that gives us a good sense of how to triage to higher levels of care when needed and appropriate, right? So that's all going to be really, really important. And I think it's also important for us to ask about that, because in recognizing and asking how a person's doing now, where were you during the event and what happened, what a person, child, adult, family member shares with us is going to give us some useful information across the different domains that we want to try to find out about, that I'll talk about here in the next few minutes, right? So if we can ask how a person's doing, maybe we sort of get a sense of some important information that's going to be helpful for us in figuring out what our next steps are, right? So we can find out a little bit of information, for example, about where you were when the particular disaster or trauma happened, right? And that can be important for us to know and for several different reasons, right? Finding out if a person felt threatened at the time or still feels threatened at the time, right? And so if a person sort of indicates that they felt really threatened or still felt threatened, that's going to be useful information for us in selecting and potentially guiding the next steps in our intervention. It also tells us a little bit of information about who else is important in that person's life that might have been directly impacted. So it can tell us a little bit of information about, for example, if someone else close to the individual, a loved one, might have died or suffered significant injury, right? Or you might be separated from someone else that's really close to you. And if we can start to get a sense of that through asking some of these open-ended questions, that's going to help point us in some important directions. So I think that, again, just knowing what a person experienced and how they were affected is going to be really critical for us to know. But with that, and let's go to the next slide, I want to mention something else here that I think is absolutely important for us to remember and consider, which is that we need to be careful not to press people for in-depth descriptions of what just happened and what they just went through. Okay, so asking folks to tell us in their own words how they experience things and where they are now is a little different than us pressing for a lot of detail about what they went through and experienced, right? And that's one thing that makes psychological first aid a little bit different from some other sort of trauma, acute trauma response kinds of models out there, right? We're not going to press for a lot of detail here. And there are different reasons for that. I think one basic reason for that is that we don't want to press for a lot of detail that may cause unnecessary distress that we can't necessarily manage in the course of one brief contact, right? So if we start to ask questions that are going to heighten distress and we don't have the ability or the time or the resources, right, depending on where we are when we're doing this kind of model, to help sort of bring people back down and stabilize them a bit, right? We don't want to get things to that point, right? So we can avoid a lot of unnecessary distress by sort of not pressing folks for in-depth descriptions of things. But what are some other reasons that maybe we don't want to get into or press people for a lot of in-depth descriptions about what happened? What are some other reasons that you think it might be important to get a broad sense of the lay of the land, but not necessarily press for a lot more detail? What do other folks think about that? Especially for some of you out there who've done more disaster and trauma focused work, I'm curious. Yeah, so I saw re-victimization come up in the chat, right? So again, asking people to sort of relive that quickly, something that they've just gone through potentially could increase risk of re-traumatization, right? So we don't necessarily want to aggravate the trauma or ask people to experience undue burden that they don't necessarily need in that moment. Yes, absolutely. Yeah, that's absolutely going to be important, right? And it could also be the case, and this is going to be, and I think this will, right, this is triage. Somebody mentioned this here. This isn't long-term therapy, right? This is more triage, and let's figure out what you need immediately. But I think one thing that's also important for all the reasons that folks, or in addition to all the reasons that folks just mentioned on chat here, right, is that we also want to recognize that for some folks, there's going to be other more pressing, more immediate things to talk about than what actually occurred at the time of the trauma, right? So for some folks, there's just going to be other things that are much more concerning to them than the details of what happened at the time, okay? And so we want to give folks the space to tell us about that. We want to learn what information is going to be relevant to focus on, if any, by getting a sense of what the person experienced and what it's like for them now, but not necessarily focus unnecessarily on things that may not be the most important thing for us to focus on for that individual, right? So I think we can sort of also keep that in mind when we ask about the trauma and try to get some information. But with that, let's go on to think about some other important questions for us to consider as we think about information gathering, right? So I think it's also going to be critically important, if we didn't find out this information already from asking about how the person experienced the trauma, how has the event impacted you, impacted your family, impacted your friends? Find out about how the trauma has also affected the people around you and the people important to you. And I think that's going to be a particularly important piece, right? When we start thinking about what social supports are available out there to help connect people with. Who can we help connect people with? In terms of practical assistance, if I can help contact someone close to you and you need help finding contact or establishing contact with that person, who is that and what can we do, right? And how can I help? So that's going to be an important area for us to consider. And I think especially when we're talking about working with youth, you know, we have a particular focus on working with youth and in schools, you know, recognize and sort of, you know, ask about how your friends are doing. So developmentally speaking, if we're talking about working with middle or high school students, you know, ask about how their friends are doing. How have their friends been affected if we're talking about a disaster or a trauma that's affected a lot of different people, right? So how have your friends been doing with all this? And I think it's also important to just, you know, ask how their interactions with their friends may or may not have been affected by what they've experienced recently, right? So are there things that you haven't been able to do with your friends lately as a function of, you know, or just as a result of going through all this that you've really been missing out on? Thinking about, have you missed out or are you concerned right now about missing out on important developmental milestones if we're talking about working with kids in schools like, you know, middle school, high school students, right? Are there things that you're not able to do now that you were really looking forward to doing? Celebrating someone's birthday, right? You know, going to school functions or events, things that are sort of rites of passage that now you're probably not going to get to do. What's that like for you, right? And how's that been for you and your friends? And so I think just acknowledging that is going to be a particularly important piece when we start thinking about how trauma has affected a person's life and how the aftermath of trauma affects a person's life. We might also sort of want to consider how a child or an adolescent's, schoolwork's been affected, right? So in thinking about how the event has impacted you, your friends, has it been harder to do things at school these last 24 or 48 hours or this last week or however long it's been since the actual event happened? So asking about that can be particularly important. Asking about how their mood's been affected. Have there been any changes in risk-taking behaviors, right? And so, yeah, and so someone mentioned on here on chat that kids will report struggling greatly and need help, but won't have necessarily reached out for whatever reason, right? And that's absolutely true. So I think in asking that and then giving folks space, right, and sort of asking these questions and sort of validating that, hey, it's okay for us to talk about some of this together, right, if that's important to you, really can open up a lot of doors. And so we're opening up doors for important concerns and conversations to be had here. And related to that, Dr. Maris sort of mentioned this earlier, focus on strengths that can help build resiliency right then and there in this contact, right? So I think it's important to ask folks, when you look ahead, what concerns do you see? What challenges do you see coming, right? And, and perhaps depending on the situation and your comfort with the person that you're talking to, what kind of things have helped you manage challenges like this in the past, right? So drawing on some of those strengths and skills, I think, can be particularly important. But give people a chance to tell us what we don't know and what we didn't think to ask, right? So is there anything else that you'd like to share that I haven't asked about that's really important, that'll tell me something about how your life has been affected or impacted? So note that with these questions, we're just asking in a broad way how a person's life's been affected, how others have been affected, and what concerns they think they have. And these sort of 5 questions that I just framed to you really, I think, will help give us information about some of the key things that we really want to know when we think about the goal of what it is we want to come away from information gathering with knowing about this person, right? So on the next slide, let's take a look at that. I'm going to go over just some of the core things that we really want to ask folks about and that we want to know about when we walk away from this conversation, right? One of the first things that we really want to try to get a good sense of, again, in a conversational way, is, are there sort of basic safety concerns? Does the person have any ongoing concerns about their own safety or their family's safety? So that's going to be one thing that hopefully we come away from that conversation knowing. Because if safety is a priority concern, that's going to probably be something that we need to focus on then and there with that contact to the extent that we're able, right? So let's come away with that basic knowledge. We want to come away with a sense of, are there basic needs that I can help this person with? So let's be mindful of that. Let's come away knowing, are there immediate basic needs that you have concerns with? And I'll just give you some examples that I sometimes see in some of the work that I do, right? If we're talking about folks who maybe suffered physical injury, right? Or maybe don't have access to money, bank accounts, or just don't have existing resources to help them get basic supplies and necessities that they might need in terms of food or things like that. How can I help link them to resources where they can get some of those needs met, right? Gift cards for food, or figuring out, how to just make sure that basic needs in terms of ability to help pay for, immediate medications or things like that are there. And so that's going to be really important for us to just know something about. We may not always have the immediate solutions available, but if we know it's there, we can help link people to the appropriate supports to get those needs met, right? And that can be really, really helpful for folks. Knowing about physical health, right? We want to know if a person was injured, if they sustained an injury in the trauma, or if somebody close to them sustained an injury in the trauma, because that's going to sort of be an important piece of a person's long-term recovery, right? That's going to be a big focus for a lot of people of what they're going to need to focus on in the immediate aftermath of a trauma. So are there physical needs? And if there are physical needs that require immediate medical care, right? How do we triage? How do we make sure that we get people to appropriate medical care? Are there financial or legal concerns that a person has as a direct result of the trauma? So those are going to be important things to know. Emotional concerns. We've talked a lot about post-traumatic kinds of reactions that people might have. We've talked a lot about grief reactions that people might have. So again, we want to know something about emotionally, how are you doing and what kind of things have been sort of happening for you and the people close to you, right? Sometimes it might be that a person has a lot of emotional concerns that is going to be important for them, but their priority may not be focusing on their own emotional concerns. It might be that I'm more concerned about how my child's doing, or I'm more concerned about how my significant other's doing, right? And if we're inappropriately focusing on their own concerns without maybe just giving some information or providing some tips or recommendations for how to support others in that moment, we miss an important opportunity to help create engagement for folks and to validate sort of where they are in that moment. So, emotionally, how are you and others close to you doing? We want to know something about that. We also want to know something about harm to self and others. We're talking about moments in people's lives where the toll and the pain of these kinds of experiences can weigh heavily on all of us, right? And often does weigh heavily on all of us. And the weight of these kinds of experiences can sometimes be so heavy that we may think about hurting ourselves. We may think about hurting someone else, killing ourselves, killing someone else. So we need to know that information as well. Knowing about substance use and abuse can be a really important thing to come away with. And so knowing that if there are immediate concerns about that, right, that we need to know something about that so we can help sort of guide the remainder of our contact. What social supports are or are not available is going to be really, really critical and essential. And then other concerns that maybe we haven't asked about. So these are really the core things that we want to know something about as we think about how to guide the remainder of the psychological first aid contact. And again, I think we can get a lot of this information by asking sort of conversational, open-ended questions like those that I sort of posted here earlier that I was talking about, and just asking, how have you been doing? What are your immediate sort of, concerns or needs? How are people, how have other people close to you been sort of, how have they been doing too, right? And so we can find out a lot of this information using conversational, open-ended questions. But sometimes we may have to be more specific. And I think the manual does a great job of sort of giving you some example prompt follow-up questions that you can ask folks, just to help give you an idea of what this might look like in real time and in practice. I'll also say that, this is a lot of information to get though. This is a lot of stuff to remember to try to ask about and to find out about. So the manual is also a great resource because it gives you some really nice handouts to sort of cover all the different areas here that you want to try to come away from that contact knowing something about. But let's be honest, a lot of times, and especially in a disaster or trauma kind of setting, we're not going to always have our handy manual right there ready to go with the with the note right there on the right page to flip to, so we can go through and just read through the list of things when we're talking to folks, right? So I think a couple of other things to sort of consider is, be creative. Find tools that are most appropriate for you and the systems that you work in to help you sort of remember what kind of information you want to try to find out something about during this particular module. So in the screenshot here on the slide, you'll notice there's a screenshot of an app called PFA App. So the developers of Psychological First Aid actually developed a really nice app that you can download for free. And so there's an information gathering module tab right there in that app. So if you have your phone, if you have a phone or some other device where you can download the app, you can click on that, and that can be a good way to just kind of walk you through some of the key information that you want to ask folks about. But you can also use other kinds of tools, right? Adapt things and develop things for yourself and for your own sort of systems and for your own sort of organizations that are appropriate that you can have handy and ready to go when the time comes that it's needed as well. So on the next slide, for example, I'll just show you some sort of other ideas. So this is actually a screenshotted example of what we call a coping card for a project that I'm on called the RISE program at a hospital here in Kansas City, where we do a lot of psychological first aid in the hospital with recent crime victims, with non-fatal gunshot victims in particular. So instead of using the actual sort of handout from the manual, or instead of using the app, we just developed this specific card that we can sort of take, and it's a card about this big. So I mean, it's sort of something small, brief, but something that our providers can pick up walk into the room and sort of glance over here at the left-hand column and just sort of, have a quick reminder of some of the key information that you want to try to walk away knowing something about, right? And the one nice thing about having cards like this printed up and just having available at your organization for use when you need is that you can get really creative with the kinds of things that you put on here. And I think you can also use it to really sort of help enhance the likelihood that the intervention will lead to good long-term engagement and outcome and really make it person-centered, right? So in thinking about how you might do that, I didn't include this on another slide, but with this particular card, for example, we just sort of on the back of it added a bunch of information about common reactions that folks will likely experience and some places for people to sort of sit down and write in helpful things that they can use to help them cope with distress. There's a place on there where you can include contact information for additional resources if people want some additional resources, right? Or there's a specific support that we know we can link someone to. We can write that information down on the back. And so this is useful for providers in the sense that we know what to ask about and it helps guide that contact. But then we can leave the card directly there with the person we're working with, right? So that they have that information there, have it handy, and they can sort of write some things down and take away some information and remember some of the information that we shared as a result of that contact. So all that to say, get creative, find ways that work for you and your organizations to help you sort of have useful resources available to help you remember how to ask about some of these different kinds of areas that we want to focus on. But with that, let's go to the next slide here. And I'm also noticing I'm running a little bit over on my time here, and I want to hand it over to Dr. Hambrick. The second and final step of information gathering is really that we need to figure out what do we do with all the information that we just got about what this person's needs and concerns are, right? So the next step is to prioritize what are we going to address. A lot of times folks are going to have concerns across multiple areas, okay? So what do we do in a situation like that? But it's often helpful to just ask the survivor which issues are going to be most pressing for you. Put it in their hands, right? And let's say what would be most important for you to focus on. And then we can kind of come up with a prioritization list. If we could handle, if we could focus on 2 of these things or 3 of these things in the next few minutes that we have, what would those be? And let's think about how we can address that. But why do we want to just hand it over and ask the person that we're working with what the most important thing to focus on is going to be, right? What does that convey? What does it say? Right, it's a sense of control. Yeah, I'm helping restore a sense of control back to somebody, hopefully at a moment when control's been taken away, right? Trauma undermines our basic sense of control, our sense of trust, our basic sense of safety. And even in just empowering the person that we're working with to say, I'm going through a lot of these different things here, but I really want to focus on that. We're helping restore that sense of control back. And so we can sort of, I think, hand that back to someone and really help promote stabilization in a very real and meaningful way there. So a lot of folks may note that they have important needs in terms of practical assistance. So if that's the case, if there's basic needs that a person needs met, we're going to want to focus on practical assistance. So let's start talking about the different modules in the PFA manual that you can draw on to help address some of the different needs and concerns that are likely to come up, right? So we get all this information from folks, what do we do with it? Dr. Hambrick's going to tell us next about what we do in terms of helping promote practical assistance. So I'm going to hand it over to her.
Yes, thank you. So information gathering is a lot to digest, and we are going to talk about this in more detail in the breakout rooms, particularly just kind of some of the ins and outs of it. How do you make it different than a clinical interview for those of you that that might have a mental health license? And how do you talk to people about who's going to have access to the information that that was shared? So we will discuss lots of that coming up. I want to really briefly touch on practical assistance. So typically, once you have gathered information from a disaster or trauma affected person, Gosh, it's so important that you act on it. It is not our job as responders to just be there because we like chaos or because we're curious about experiences that people may have had. It's our job to be there, really to do concrete things that can help an individual on the path to recovery. So the next slide, please. Practical assistance is another one of those really what I would call deceptively simple or perhaps actually simple steps, but it's just so important that it happens. I mean, truly anyone that you've gathered information from, I would really challenge you to be able to walk away from the encounter and say, how did I do something practical? How did I actually, a better way to say it is, how did I help this individual engage even in some practical assistance for themselves by prioritizing needs, that sort of thing. So once you've gathered information, Joa just talked a little bit about prioritization, and often what should be at the top of your priority list is something pressing that can be achievable pretty quickly. If you can help someone meet a goal or get a need met quickly, that will help restore their sense of control. That will help restore their sense of self-efficacy, which are really going to be huge in terms of promoting their path to recovery. What's important here, though, and we've talked about this in previous sessions, is really clarifying the need that you want to move forward on. There's really nothing worse than having something bad happen to you and having someone come along to help who's really kind of just pushing their own agenda of what help looks like, right? That, you know, they want to help so badly, so they help another person in the way that they would want to be helped, but not in the way that the trauma-affected person would want to be helped. It can be so easy when we feel stressed as providers to just want to jump in, but it's very important when we are wanting to provide practical assistance that we go back and re-clarify with the person. You know, I've heard you say that something that's bothering you right now is that you have not been able to contact your mother. Am I correct in assuming that that's something you'd like some help with? That that maybe I could you know, find a cell phone that we could call your mother on, or that maybe I could help track down where they might be. For example, if there's people at a variety of shelters in the middle of a weather event. And after you've clarified the need, you really want to discuss an action response with the individual and kind of weigh the pros and cons of it. Maybe there are several different ways that a practical need could be addressed. Lots of people, for example, might really want to talk to a spiritual support person. And knowing that is great, but it's only one small part of providing practical assistance. When might they want to speak with this individual? Do they have a specific individual in mind? If the individual that they have in mind can't be reached or accessed, what might they like as a backup plan? Do they want to wait until that person is available, or would they be comfortable talking with a different person? You know, these seem like small things, but they can be extremely meaningful in the moment in terms of ensuring that you're really providing the assistance that the disaster affected person needs. And then, of course, I said this already, acting on it, acting to address the need. Next slide, please. So this is just a little bit of a recap, but another big focus here is small, achievable goals. We want to walk away from this with a success, with something in the positivity bucket. And so we don't want to think too big. We're thinking, I mean, practical assistance could be something that helps them just in the next 5 minutes. And that's great because that has said, yes, something really bad just happened, but we are slowly going to move forward into your life, building successes again, building self-efficacy. You can move on to the next slide, Christy. And, you know, what's kind of the theoretical rationale about why this is so helpful and useful? Well, it can be really helpful in terms of reversing any feelings of failure or inability to cope. When something bad has just happened to you, often you have a lot of heightened energy, but don't have anywhere to put it. We've kind of talked about that hyper arousal that can happen following a disaster or a trauma. And it can be really great to kind of help someone focus or channel their energy, even if it's on just a small step forward. And like Joa alluded to, when we gather information, really the whole goal is to be able to provide this immediate practical assistance. So seeing these as linked is really, really key. How do I get information that will help me assist or structure this encounter such that the individual gets an immediate need met? Next slide. It's also really important to focus on one need at a time. So when we talked in a previous session about establishing a sense of safety and comfort, a reason that that is so important is because people who've just experienced trauma, again, they might be in a heightened emotional state. They might be having some dissociation. They might be having some hyperarousal, and all of those things can make it hard to plan for the future and, even problem solve sometimes. Again, we don't want to focus on the weaknesses of disaster survivors, but I do think we have to be realistic about the mental and emotional state that people might be likely to be in. And so helping persons have great intentions, but we don't want to set the bar too high. We really want to focus on one need at a time and make sure that we have measurable, achievable success. So just a quick example of a way that I've provided practical assistance. So as part of the place where I provide some clinical services, we had a therapist kind of staffing a crisis line for the patient. So these individuals were actually patients in this case, but they weren't necessarily my patient when it was my week to be on call, right? So it really was a crisis line. And I found practical assistance to be a really effective core action to use kind of after I gathered some information, because it wasn't like as part of working that crisis line, I was supposed to be the person's therapist, but I was supposed to figure out what's the immediate need? Why has this individual called? And then it was very important to me in the moment to try and act on it, right? So, when I had someone call and the concern, kind of the immediate concern was I'm at home and there wasn't any physical violence going on, but the person had kind of noticed, I just can't quit bantering back and forth negatively with another person in my home. We're just in this cycle where we're at each other and it's everybody's fault all at the same time. And so in that moment, I actually did a little bit of deep breathing with the individual so that we could kind of be in a state to think some things through. And then we set a goal of literally just getting out of the house and into the car. What things would you like to take with you? What might be both positive and negative ramifications of you deciding to take that type of space? So making sure this was something the individual felt comfortable with, and then staying on the phone until that goal was achieved, until that had happened and the person felt a little bit of efficacy and more control over their current behaviors. So, what we're going to do right now is, Melissa, I think we will go ahead and move on to the social support part. And if you all can hang in a little bit, we'll take our break at more from like maybe 2:02 to 2:07, if people can hold on a few extra minutes.
That sounds good, Erin. Thanks. Did you want to do the word
cloud? No, I think we'll skip it.
Okay.
Yeah. Thanks.
All right. So I'm really excited to talk to you all today about connection with social supports. Joe talked a little bit about this in his introduction, But social support is an important part of PFA and responding, and something that I think we all naturally do, but it's important for us to kind of put this as a reminder. Chrissy, if we can go to the next slide. And really our goal with social support is to establish brief or ongoing contacts with primary support persons or other sources of support to facilitate both receiving and giving support. So important pieces of this goal is one, so establishing contact, right? Either with the primary support person or other source of support. And so by being a person, another caring human who is competent, interacting with someone who has survived a traumatic event, you are now social support, right? You are providing immediate social connection, right? And so what we're trying to do is then expand and multiply that as much as we can. If we can connect someone to a primary support person, that is fantastic, but also looking around to see who might also be available in the short term, particularly as you learn more in the information gathering step about who may or may not be available in the immediate kind of short term afterwards. I also wanted to highlight here that this is this step focuses on both receiving and giving support. I feel like this was something that came out of the COVID pandemic in a pretty significant way, was a pretty quick focus on the role of helping, volunteering, giving to others, in dealing with or using that as a coping strategy to deal with some of the anxiety and some of the feelings that went along with everything being shut down. So that we can be in a role to receive that social support, which is important, but also sometimes by giving social support to someone else, we actually also can help ourselves. And so there's a lot that comes along with giving of social support as well. And when I think about social support, I think about kind of one of my, or some of my very immediate conversations right after everything shut down, you know, a year and a few months ago. And I shared earlier that I do a lot of work with school districts. And as I was talking to superintendents and school counselors and other folks in leadership positions, school nurses, the first thing most of them said after school shut down was, well, what do we do? Who is connected with these young people? It was the social support, it was the contact and the connection that they were most concerned about. And it continues to be one of the things that a lot of people are concerned about is where have some of these children gone? How are they connected? What is the social support? So we want people to feel connected in the direct aftermath of a trauma for all kinds of reasons, but in particular for what Joe said, because we know that it's a protective factor. We know that long-term, short-term outcomes are better if someone does not feel isolated, if someone knows that they're connected and can go to someone for help. Can we go to the next slide, Christy? So kind of two sort of big ideas when it comes to connecting with social support. The first one is connect. So taking practical steps to help survivors connect with primary contacts. Of course, this is going to depend on the developmental age of the person that we're talking about. And, you know, working with a 15-year-old survivor is very different than working with a 5-year-old survivor in terms of that primary contact. And again, that we're thinking about an entire family, an entire community and the impact there. But during the information gathering part of this is where we're trying to listen for kind of who primary contacts might be. Does a person reference someone in their family? Do they, you know, call their grandmother Grammy? You know, these are the kinds of things that if we can pick up on, and then we can circle back when it's time to kind of think about the social support and the connection, it can be really powerful. But it's also really important to remember that we are all in a position where we can give and receive social support, right? And so sometimes it might be more practical to think about how we can encourage connections with immediately available sources of support. So who is in the physical proximity? If it's a situation where you have access to, you know, internet or phones, is there someone who could be called quickly, right? Who is immediately available? And really thinking beyond even just kind of our primary friends and family, thinking about, is there a coach? Is there a faith-based connection? Is there another young person who they want to connect with? And again, we're trying to encourage those connections over time. And when we think about working with young people in particular, so children and adolescents, being creative with this, right? And so again, we're in a situation, we're quickly scanning and trying to understand what kind of resources we might have to work with. And of course, we as humans are resources, right? And so everyone who is there now becomes a resource for all kinds of things, including social support. So social support might look like connecting this 6-year-old child who just survived something with this 7-year-old child who also survived, right? And helping them play together or color, and just at a really basic level, how vital and important that can be. When I think about some of the things that really sort of stood out from the Hurricane Katrina response, is in many of these really large shelter situations, one of the very first things that a lot of the really good, healthy, supportive spaces did is get school going again, get a schedule, get activity, and get connection happening. Play games, draw pictures, talk. And again, if the connection isn't happening, and maybe we're trying to follow the individual's lead, and they're saying, I don't want to talk to anybody, I don't want to talk to you. And so just, okay, that's fine. I'm just going to be right over here, right? So you're still connecting, you're still showing your support there, but really, again, following that person's need. And I think it's helpful, and something that my colleague Erin reminded me of earlier is that really when we think about connection as in social support, as one of the PFA core components, we're really talking about safety and comfort, right? Because at a very basic space in our brains, we need to connect with other people as human beings. And so part of connection is kind of helping our brains be as healthy as possible, to deal with whatever is going to come next. And we know that our brains actually are going to work better if we are connected to other people who we can trust, and we can connect with at any level. And so this is a really important step here. Chrissy, can we go to the next slide? So we had the connect part, and then also this idea of kind of show and tell. So these are all things that we can do. There were some questions in the chat earlier about the PFA manual and how we take it in and absorb it and get it ready to use. I reference here the PFA manual on page 72. There's a lot of really good stuff in there. I really like scripts, and having those handy for lots of different reasons. But it's really good to have, the actual language that you're going to use, to have it and to practice it, because you don't want to have to come up with stuff when you're in the moment trying to deal with something and trying to address something, right? And so practicing the language beforehand can be really helpful. So in addition to connecting people, either a primary support person or someone who is more immediately available, we can also model support. So there are some examples here. And for those of you all who do have a mental health background, these are going to sound familiar. But essentially what we're doing here is we're trying to talk to someone and connect and trying to understand. We're trying to show them with our words and our actions that we are there to support them and to help them. And so just using a reflective statement, it sounds like you're really frustrated. If you're not sure how they're feeling, take a good guess and they will correct you, right? That sounds really hard. That sounds really sad. And trying to connect, so reflecting that, clarifying. So Erin actually gave us an example of this. If someone says something, asking them, is this right? Letting, sometimes, and I do this a lot and talk about doing this, especially with young people, but this works with adults. Ask people questions that you know the answer to, but you also know they know the answer to, right? How do we prioritize? Is this right that you call your grandmother Grammy? Great. Okay, guess what? Now someone else was right and they got to tell you something and we're now interacting. Just making those supportive statements. This sounds really hard. This must be really hard for you. And then this idea of empowerment. So really trying to build on strengths. This will maybe sound like a solution-focused sort of approach. But really, what have you done in the past that has worked that maybe we can try again? If you felt like this in the past, what's one thing you have done that has helped you feel successful? And then the other thing we want to do is we want to talk about seeking and giving support. So here we're really laying the groundwork. Again, PFA is designed to be done by anybody. And so here we're just trying to plant some seeds for what can come next, for what we know might be a short-term or long-term outcome in terms of some of the challenging thoughts and feelings people have after a disaster. And so the kind of the sum point of this is it's okay to ask for help. This might be hard and it's okay to ask for help. Please ask for help. I'm here to support you. What can I do to help? But really underlining this message of asking for help and making sure, again, that we're trying to help people connect to each other. And so asking for help, asking for what you need to help people sort of navigate through some of the big feelings that often come after a disaster takes place. Chrissy, if we can go to the final slide here. So this is going to be the last slide, and then we're going to take a break. But in terms of kind of sort of things to keep in mind as we focus on social support, this has been a repeating theme throughout these webinars, but we really want people to take the lead. The person who has been affected, the disaster affected person, is in charge, and we want to try to be as responsive as we possibly can to what they need and what they want and what they're saying. In these conversations, we're really trying to focus on practical assistance and problem solving and concerns. We're not trying to open up story time to revisit disaster, revisit what happened. If people come to us with that, that's okay. We don't want to shut anybody down, but we don't want to end up with a situation where we maybe have tried to pair a few people who could connect to each other, right? And then they all sit and begin reliving what happened with each other. What we want to do is focus on connection, focus on practical, problem solving. There will be time later to go back through and process. In the immediate aftermath of a disaster, most people's brains just simply aren't in a good place to process what happened and what it means. People have practical needs and need practical assistance. It's also important here that when we think about connection with social support and the person who is affected leading the way here, that we remember that we bring our own stuff and our own baggage and our own identities to the table, and just being aware of that. So we don't want to make assumptions about what people want or need. We want to listen to them. We want to ask them. Just because I think what somebody is focusing on seems small or irrelevant, that just means it seems small or irrelevant to me, not to them, right? So this is what's important to them and letting them lead the way. And also just trying to be as aware as possible of sort of what we bring to the table, but also how someone else in that context might be responding. So last week we had a scenario where a young person was affected in a situation and felt like things were kind of being done punitively or thought they were in trouble. So we want to be aware of things like, the impact of being in a hospital for some people, or being in a setting where there's law enforcement. We want to think about the power hierarchies that exist when a grown-up is talking to a young person at all, right? We want to understand what it means for a school superintendent to talk to a student, and that there's other things involved there, and just try to do the best we can. Again, this isn't something that is ever going to look perfect. We, show up and do the best we can with the knowledge that we have, always questioning what we know. But we just want to try to be aware of those things. And again, following people's lead as much as possible. I did want to just kind of alert you all. Appendix E has some really great handouts. There are some really great parent tips in there around, some ideas and strategies for parents and caregivers, and also some social support kinds of ideas. These are the kinds of tools that I find it helpful to have on hand. In any situation, any of us, as prepared as we are, oftentimes get a little scattered and get a little overwhelmed. So what can we reference? What can be our touch point, just as a kind of a good reminder? Here are some sort of key ideas, do this, try not to do this. Again, to try to enable ourselves to be as successful as possible. So with that, I think we are going to transition into a break. Erin, you said 2:02 and it's 2:03, so I'm feeling pretty
great. Yeah.
You're on time. I like it. So do you want to transition us to break, and then we will come back?
Yes, that's right. So we'll take a 5-minute break, and then we will come back, spend about 20 minutes in breakout rooms focused on information information gathering, and then end discussing a scenario. So we'll see you all back here soon. Okay, I see that our break has ended. So hopefully you got to stretch a little bit. I didn't bring back the chair yoga for this week. Might bring it back next week though, to get us through the fourth and final training. Okay, so we are going to move to breakout rooms. So you'll either be with me, with Dr. Maris, Dr. Williams, Dr. Zhang, and we will be kind of working through this information gathering piece. What does this really look like if you're going to gather information on current needs and concerns from a disaster affected person? So with that all said, you should be receiving an invitation any moment to join a room, and we'll be there for 20 minutes.
I think we should have about everyone back in our
Good.
room now.
Okay, great. Thank you. I was like, I didn't know where we were in terms of that. So as usual, I'm sure you all kind of got cut off there at the end, but room one had some really great examples of how to go about information gathering in a situation like this. And some things that we saw that were really great in my room included really that present focus. What can I help you with right now? And really good lines of questioning, keeping in mind, what do we know has happened and how can we ask some questions that might help the individual elaborate on specific things that might have happened to them. We had somebody kind of inquire, did the police come to your home? It was a great question, right? Because that could be a really stressful experience for a child, depending on their history of interactions with law enforcement, or just even for kids, sometimes having first responders come in can be quite stressful, and knowing if that was part of the child's experience can help you provide assistance. Good. See, lots of great shout outs to the other rooms as well. So hopefully everybody had a good time. Any other wrap up things real quick, because I want to make sure we have some time for today's scenario, but just want to make sure there aren't any.
Erin, the one thing I wanted to highlight, so Sonia in room 2 did a really great job kind of seamlessly kind of how they would respond in that situation. But also Chad actually shared that they opened up the app on their phone and was complimenting Sonia on kind of walking through all the steps. So we kind of revisited this idea that having something that's on you and available, usually our phones are on us and available, that can just be a reference, can be really helpful. And so I really appreciate we walked through it and then kind of process through kind of some of the key steps there, but I thought it was a really good discussion.
Yeah, great. Thanks for that. Yeah.
And I also want to jump in and just, and say as well that I really appreciated the questions and all the insightful thoughts and comments from folks in room 3 as well. But one thing that was mentioned in our group that I wanted to come back to, we didn't quite have time to fully address in our breakout room, but I think will sort of set us up nicely for the conversation that we're going to have next week for our final session for the Echo, was just, this idea of this is different from therapy, right? But a lot of us do have mental health backgrounds. And for those of us that work in mental health professions or in helping professions, there's still a pull to want to try to, validate and to provide some, empathic sort of support and reflection in those moments. And thinking about not forgetting that can still be an important piece to all of this as well. And I think it's absolutely important to do that. But one person in our group in particular, and Alex, I believe it was you that said something here that I wanted to come back to and highlight that I think was particularly important and helpful to reflect on. That's going to be a big piece of providing information for coping when we talk about the information on coping module next week. Was that you sort of mentioned when in our role play, I kind of mentioned, that the person that I was role playing was feeling kind of shaken up by everything that had happened. And and then sort of responding to that in the role play, you said, that I'd want to validate that, and, also sort of just let you know that that's a normal response, right? And a big piece of what we're going to talk about next time when we talk about information on coping and the importance of that module in psychological first aid is that normalizing reactions can go a very long way for folks who are feeling very aroused, very sort of, distraught or distressed. And I think just letting folks know, especially if we're talking about recently bereaved folks or traumatically bereaved folks, right? If we're talking about loss of life, or people may have lost someone close to them or have been separated from other people, normalizing and validating people's reactions can go a very, very long way. And we'll talk a lot about what that can look like next time and how you can do that. But again, I really appreciated that was said there. And I think integrating that into our information gathering piece is something that I often find myself doing when I'm doing information gathering. When folks, especially if I ask about how have you been doing emotionally, and folks sort of talk about what they've been experiencing, I'll often end up, talking a little bit about that, providing some psychoeducation about, common reactions that folks have, and try to normalize that for people. And, without getting too in-depth about that today, because I want to save some of this for next week when we have more time to sort of talk about that specific module, I'll just briefly mention that in studies that we've done, for example, in some of the work that my colleagues and I at other situations, other locations, or other institutions have done elsewhere, we've done work, for example, with violently bereaved families, and talked a lot about what kinds of things would you have found helpful, did you find helpful in the acute aftermath of death notification and other kinds of things that often happen. And one thing that people have repeatedly told us is information about our emotional responses. If someone had been there to just tell us a little bit about what we were experiencing, what we were likely to experience, and just to let us know that we're not going crazy, that what we're experiencing is normal, it would have felt a little bit easier to try to cope with and manage, right? So I think that when we know that a person's reactions are well within that range of normal responses that people are going to have, just simply acknowledging that, talking about it, validating it, and empathizing in that moment can go a very, very long way. So generously weave that in when you're gathering information about a person's responses. And I really appreciated how that was shared there. So I just wanted to also highlight that.
Need to close out. Thank you very much, Beth. Thank you for this great conversation. Anyone who has similar scenarios to Beth, maybe she would be a great resource given all of the work they've done in this area. And we will see everyone here next week for our final one.